What are the different types of diabetic retinopathy? And this essentially falls into two categories. Firstly, there's what's often known as a background diabetic retinopathy, where you have leakage from blood vessels in the posterior or the back part of the retina around the macula. And this can be in the form of hemorrhages or fluid, sometimes known as exudates. And if this progresses and comes in front of the macula, it can obstruct vision and cause reduction in vision. You can also get an overall swelling in the retina, becomes edematous or boggy, and again this will cause a reduction in the vision. Hence the importance of screening and therefore the potential to treat these conditions. The other type of retinopathy is known as proliferative retinopathy, where new blood vessels grow from the optic nerve at the back of the eye, from the retina, or from the iris and the front part of the eye. If these occur, then treatment needs to be instigated, as the blood vessels are fragile, they're abnormal, they're trying to bypass blockages in the circulation, and this can result in hemorrhage, scarring and retinal detachment, and potentially significant loss of vision. The treatment consists of laser photocoagulation, and more recently we have been using the drugs for macular degeneration, known as anti-VEGF drugs, for example Eylea and Lucentis, to kill off these blood vessels and regain control of the situation, possibly combined with laser photocoagulation to effect a more permanent solution.